Well, hello, welcome. Welcome to the MBLEx review course. My name is Jody Scholes. I am your instructor for the MBLEx review course. And today we are talking about navigating the body. This is a foundational class. It's designed to give you the tools that you'll need to build on. So when you build a house and you have a foundation, that's what you build on. And so that gives it the strength. Maybe you're going to build on, a basement or cement or a slab. But today is our foundations day, a foundational learning day. And I call it navigating the body because we're going to be talking about the regions of the body, movements of the body, and the systems of the body. And that just kind of brushes off that stuff you learned in school. Our class today is in 3 parts. The very first part is some test-taking strategy, some study strategy. The second part will be our learning. And then the final part of class today is dissecting questions. And the third part of class is designed to give you more tools in your toolbox so that as you take the MBLEx, that you have a strategy in tackling those questions. In fact, I talked to someone, I haven't even posted her congratulations post yet. Her name is Kristen, and Kristen passed the MBLEx and this on Monday. Anyhow, but she just passed the MBLEx, and she said that during the MBLEx, that all of a sudden she got nervous for a second because the questions were really hard, and then she remembered, hey, wait a minute, if I'm getting hard questions, that means I must be answering them right. And so I like to give you these test-taking strategies in dissecting questions and understanding the nature of the exam so that you have even more tools in your toolbox other than just your big brain in your head. All right, so those are the 3 parts of class. The very first part of class is our test-taking or study strategy. And I want to share with you today. Well, first of all, I want to share with you. You can say hello to everybody in class. Now you can see everybody. Yay. All right. And I want to share with you where to find the study guide. Let me make sure I've got it pulled up. Very good. I think I got it pulled up right there. Oh, yeah. Okay. So thanks for your patience. It's not. Oh, there it is. Okay, I'm like, it always lets me do this. All right. So this is the Federation of State Massage Therapy Board's website. This is where you go to register for your exam. And I wanted to show you the exam content. So what I did is I came to their website. This was their landing page. And then I went over to MBLEx. And down here, I went to exam content. And quite often by graduates, I get asked, what's going to be on the MBLEx? How do I know what to study? Well, here is a cheat sheet. Here is what I prepare my classes with and what you can look to see if it's something you need to study. So we land on the page that says exam content, and then we go to MBLEx content outline. And here you go. This is what they tell us is on the test. Let's make it a little bigger. And this is how I set up our 8-week cycle, because we've got 7 categories here on the exam content outline. And so we work through each of these categories. So here you go, anatomy and physiology. And you see this little 11% that's beside it? That means that 11% of your exam is going to be on anatomy and physiology. So since we know there's 100 questions on the exam, we know that 11 are going to be specifically related to anatomy and physiology and system structure of these systems, system functions of these systems. So today in our class, we're going to be going through the different systems of the body and reminding you on what they actually do. But let's look at their kinesiology, that's movement of the body, 12%. Pathology, contraindications, areas of cautions, and special populations. Again, the bullet points. Benefits and effects, benefits and physiological effects of massage, 15%. So 15 questions out of the 100 are going to be on the benefits and physiological effects of massage. Next category, client assessment, reassessment, and treatment planning. Got a question this week on SOAP notes and the P, that treatment planning. That treatment planning in your SOAP notes is actually future planning. So it's asking you to assess what you did with the session and then make a plan with your client. So that's why this category is assessment, reassessment, and then treatment planning. Now look over here. See this? Ethics, boundaries, laws and regulations, and then guidelines for professional practice. Nothing to do with anatomy. Nothing to do with pathology. This is business. This is ethics. This is laws, regulations. This is professional practice stuff. And take a look, you guys. 16% and 15%. Together, that makes 31%. 31 questions on your MBLEx are going to be about business, how, your professionalism, sanitation, cleanliness, code of ethics, laws, that type of stuff. And so here's a list of what they're expecting you to understand and be familiar with. All right. So that is your prelude to what you need to study. I will attach that document to the recording from today when I post in the Patreon account. And so you'll have a copy of that document and you can refer back to it. So just save it on your computer because it is helpful sometimes to look back and just say, okay, do I need to know this? A few years ago, they eliminated history of massage. You now don't need to know it. All right. So I wanted to say thank you to Trail Guide to the Body. That's one of the books that's given me permission to actually use their images. So some of these images are used that you may recognize from a book called Trail Guide to the Body. All right, let's start. Navigating the body starts with the foundation of understanding that all of these directions, all of these movements start with anatomical position. And so anatomical position is what you see right here. And let's take a closer look at it. So anatomical position is the individual standing feet together, arms at your side, heads pointing forward, palms are pointing forward, thumbs are out. So as you see, this is, I think it's even called mountain pose in yoga. If you yogis are out there, you can let me know. But anatomical position is the foundation from which all movement is described. All of us, so the rest of your clinical lives, this is how you communicate with colleagues about movement, pain, dysfunction. All of that starts from anatomical position. So as we look at the regions and movements of the body today, just know that we're starting from this position. All right. So in anatomical position, we also have what's called the midline of the body, right down the middle. So the midline of the body, and we determine a lot of movements by whether they are moving toward the midline of the body or away from the midline of the body. So medial, going to be closer to the midline of the body. Lateral, going to be farther away from the midline of the body, so the lateral side of things. We also have the directions of superior and inferior. Superior being higher, inferior being lower. This applies to both the upper and the lower body, and you'll see this when we look at proximal and distal. Now, you might say superior and inferior, but for limbs, we're typically using a directional term called proximal and distal. So proximal is closer to the midline of the body. Remember that midline. Distal is further away. Now, it seems as though that's a little counterintuitive here, but distal is further away, so the foot is distal to the hip. The hip is proximal to the foot. A couple of other anatomical terms we want to visit, and that is anterior and posterior. So here we go. Anterior is the front, posterior is the back. Another term for that every now and then will come up on the MBLEx is ventral and dorsal. Typically, ventral and dorsal are used in veterinary medicine, but every now and then it comes up. The ventral refers to the front of the body, and the dorsal refers to the back of the body. In another slide, we're going to see a picture of a dorsal fin. You may recognize that anatomy, but you can see here with the little hot dog, dash sound. So dorsal, see how it's up? It's the back of the body, but ventral is the belly. And likewise, another anatomical term we very rarely hear, but cranial versus caudal. And caudal is the tail. So cranial is the head towards the cranium, but caudal is technically the tail. So we have a cranial, and the caudal would be towards the butt. We don't have a tail, but our tail end, so that would be the butt. A couple other planes of movement and a revisiting of directions. So we're going to see this again, but this is an introduction to these three planes. The sagittal plane is the blue line here. And I like to think of sagittal, to me sounds like saddle. So if I was sitting on a horse, that saddle would cut me in half, right? It would divide me. So saddle, sagittal, right up the middle. That's that blue plane right here. And then we have the frontal. So the frontal plane, so makes sense. What's front from back? What's anterior from posterior? That's here, in the frontal plane. And then we've got what's called the transverse plane or the horizontal plane. So transverse, it's that flat plane, the horizon, the horizontal plane. So right here we see an example of that, the transverse plane. All right, another look at superior and inferior. The shoulder is superior to the knee. The knee is inferior to the shoulder. And we have another image here for cranial and caudal, but just remember cranial is towards the head, caudal is towards the tail. So it says down, but it's towards the tail. So that general direction. Here's another look at those planes. So you'll see the sagittal plane, dividing the body left to right. The frontal plane, dividing the body front to back. And then the transverse plane, or sometimes called the horizontal plane, and that's straight across. All right. Let's visit the regions of the body. Now, again, this is navigating the body, the class, navigating the body. And so this is your foundation of terms. So we talked about cranial, and then here is the spine. These are regions of the body. So areas of the body. So here we have the neck, the posterior part of the neck, which is called your cervical region, where those 7 cervical vertebrae are. Right here, from the occiput, C1 to C7, that bony prominence. The acromial region, where the acromion process happens to be. Scapular region, where the scapula is. We move down to the mid-back, the thoracic back. And tell me in the chat, tell me, how many thoracic vertebrae are there? So go ahead and post that in the chat. But right here is that thoracic region. We have thoracic vertebrae. And how many thoracic vertebrae do we have? As we move to the lower back, we see the lumbar region. I've got some answers. Very good. Yes. Lana says 12. Yes. Marina says 12. Yes. Valerie, yes. Pumala, yes. Good. Excellent. So 12 thoracic vertebrae, all of those attached to a rib. So we have 12 ribs. Some people are born with an extra rib, but in general, there's 12. And then we move down to the lumbar region, and we have 5 lumbar vertebrae, those big, thick lumbar vertebrae. Under that, and this is the lumbar region. And we move into the sacral region, defined by where the sacrum is. This is the pelvic region. Sometimes we'll talk about the pelvic bowl or the pelvic basin. That's the pelvic region. And here, this would be the carpal region, where we have our carpal bones, right? Carpal region. We've got the dorsal side of the hand, which is the back of the hand, the dorsal side of the hand. And we've got a digital region where our digits are, our fingers, the gluteal region where our glutes are, and the popliteal region, the posterior part of the knee, the popliteal region, also considered an endangerment site. So we don't massage directly on the back of the knee here in the middle part, but it's really nice to massage on the sides here where the hamstrings attach. Yeah, so very nice. All right, the facial region, the mandible region, supraclavicular, above the clavicle, supraclavicular. We've got the pectoralis region, and here the axillary region. Axillary, remember the armpit, the axillary? We've got a brachial region. Cubital is the elbow. Abdominal region, here in the belly. The inguinal region is where the inguinal ligament is. The pubic region, the femoral region. We've got the antecubital, so the inside of the elbow, the antecubital, also considered an endangerment site. We don't like to put too much pressure on the inside of the elbow. Really? Yeah. All right, the palmar region, the patellar region, and then the dorsal region of the foot. So the plantar region is the underside of the foot. So the underside. And we'll take a look at movement there in just a moment. But I've circled this dorsal side of the foot because that has come up on the test. And I wanted you to see, some of you will be familiar with the dorsal fin on a dolphin. And I like to think of that like kind of a dolphin fin on the top of my foot. That's the dorsal region. It also will speak to dorsiflexion versus plantar flexion. So top of the foot, top of the hand. Think of it as having like a pointy fin, like a dorsal fin. So the dorsal region. All right. Oh, I wanted to show you the brachial region here. So I've circled brachial because every now and then you'll hear about brachial plexus. So I wanted to just show you a picture of this. This is the brachial region because of these yellow nerves that originate here. You can see C5, C6, C7. And then right under the clavicle, but above that first rib, this nerve bundle goes down, and that's the brachial plexus. So our brachial region speaks to the brachial plexus, this nerve bundle that goes all the way down our arm and innervates our arm. And you'll see here a very nice picture too. This is the pectoralis minor. So when we're dealing with the brachial plexus, the brachial region, sometimes problems are caused by the pec minor. You'll see that because it goes under the clavicle, above the rib, but under pec minor. So if pec minor gets tight, can sometimes cause some tightness in that region. All sorts of other things cause problems in that region. It can be an accident, slam in the shoulder. But just wanted you to be familiar with the region and brachial plexus. We're going to go into talking a little bit about movement, but wanted to familiarize you again with what a scapula looks like. And if you were guessing, is this a left or a right scapula? You can put it in the chat. Is it left? Let's see. Is that left or right? Okay. And so the scapula, you can see here, this is an anatomical structure that you'll want to know the name of. This is called the spine of the scapula. This is so this is the spine of the scapula. This is the medial border of the scapula. And this is a little area called, ooh, we got a couple answers coming in. Boom, blah. Yes, yes, Tanya. The question was, what is this, a left or right-handed scapula? Would you find this on the right or the left side? Just based on what you see here. I want to mention that there's your rotator cuff muscles live all around this scapula. And the rotator cuff muscles with the abbreviation. Ooh, okay, here we go. Ready? Who can tell me? Oh, you see it right here, I guess. Well, you see supraspinatus. And here's infraspinatus in here. But there are two other rotator cuff muscles not pictured here. What are the names of those? I've given you the acronym. The acronym is SITS, S-I-T-S. So we've got supraspinatus and we've got infraspinatus. So infraspinatus is the name of that, and that's actually where this lives. Right under the spine of the scap and above the spine of the scap. Very good, very good. So what are the two other rotator cuff muscles? We've got supra, infra, and you can put them in the chat if you know those. We'll come back to that. All right. So let's look at some movements of the scapula, movements of the shoulder. So elevation and depression. So elevation, easy, right? Up, elevate, elevator. Depression, down. If someone's feeling depressed, they're feeling down. So the scapulas move up and the scapulas move down. Yes, very good. Yes, so we have our answers in the chat for the two other rotator cuff muscles that were not mentioned, and that is teres minor and subscapularis. So, very good. Those are our four rotator cuff muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. And those are going to be moving, doing some of this movement. So let's look at how the scapula moves. We can elevate and we can depress. We can adduct the scapulas. So adduction, we haven't covered that yet, but when we adduct, like adding and subtracting, adduct, we are moving closer to the midline of the body. So go ahead and pull your shoulder blades together where you're sitting. Pull them together. You might want to bring your elbows back. Bring those scapulas into adduction. Also can be called retraction. So pulling those scapulas together, I like to imagine that you've got like a walnut in between your shoulder blades and you're trying to crack it. Yeah, that's adduction of the scapulas or retraction. Abduction of the scapulas, we're going to abduct. We're going to move away from the midline of the body. So in the picture here, he's throwing a punch. So we're moving those scapulas forward. So bringing maybe your elbows together, bringing that arm into a punch. That moves the scapulas away from the midline of the body, and sometimes called protraction, but mostly called abduction of the scapulas. We saw depression, elevation, and depression, and we've got some upward rotation and downward rotation of those scapulas as well. Sliding over to the shoulder joint. The scapula is not the shoulder, anatomically speaking. The shoulder joint is the glenohumeral joint. It is a ball and socket joint. So that socket is the glenoid cavity. The head of the humerus is in that glenoid cavity. Technically, it's called the glenohumeral joint, but it's a ball and socket joint. And when we talk about the shoulder, we're talking about the shoulder joint. So let's look at movement of the shoulder joint. Okay, flexion. Flexion of the shoulder. Extension. If you've ever seen track and field, when they hand off the baton and they hand it off to the person who's running up behind them, or actually they're going to be receiving the baton, right? If they're sticking their arm into extension is that movement behind, extending the shoulder joint. We have another example here of adduction. So this is in the flexion and extension happen in the front and the back, the anterior and the posterior. Adduction and abduction happen in our lateral plane. So when we get closer to the midline of the body, we're adducting the arms. When we're moving away from the midline of the body, we're abducting the shoulders. Probably not going to see that because it's a little tricky, but just so you know that it happens in a different plane. Flexion happens in front of you or behind you. Adduction and abduction happen in the lateral side. Few other, okay, so horizontal adduction coming in towards, so you can see here, horizontal adduction coming towards the midline of the body. Abduction, horizontal plane, right? Transverse plane. Abduction, away from the midline of the body. So if you're adding like an equation, like the plus sign, when you add, get closer to the midline of the body, that's adduction. When you move away from the midline of the body, that's abduction. It also can be called internal rotation, lateral rotation, medial rotation. Well, medial rotation coming in, lateral rotation going out. Feel free to pause or look it up on YouTube if you want to get a more detailed expression. But this is also a lovely slide that just explains the movement of the scapula during these shoulder movements. So shoulder flexion, you can see right in front of you. The scapula elevates and upwardly rotates. During extension, the scapula moves down, gets out of the way. Shoulder adduction and abduction. Internal rotation and external rotation. I just like that because they're revisited with a little bit of a clearer picture on what movement is happening at the shoulder. So shoulder internal rotation, right, with this movement. The shoulder, the humerus, is actually internally rotating. The head of the humerus is internally rotating. All right. Here's our abduction and adduction. And so you can see abduction of the hip is moving away. So we've talked about the shoulder. We talked about adding to the midline of the body. Abduction of the hip is moving away from the midline of the body. So that foot is moving out to the lateral side. Adduction is that movement back towards the midline of the body. So in this example, she's moving her leg back in, her foot back in. And go ahead and see this too. That adduction can be crossing the midline of the body. See how this foot, like imagine she's playing soccer? So that's still considered adduction, even though you crossed the midline of the body. So this is abduction of the hip and adduction of the hip. A few other movements of the body, extension and flexion of the fingers. We see again here a picture of adduction and abduction of the hips. See it moving in, adduction. This is also where your adductors are, right? If you're sitting, go ahead and touch where your adductors are. They're between the inside of your knee and your groin. That's where your adductors are. Some people refer to that muscle just as the groin muscles, but adductors adduct the hip. Then we have abduction, abduction of the hip, moving away from the midline of the body. Medial rotation of the shoulder, lateral rotation of the shoulder. And then with all of these different rotations, we're going to take a look here at upper body movement. And so we've got lateral rotation of the shoulder joint when the arm goes out, but rotation of the spine. Rotation of the spine. And that is going to be our whole upper body moving. This is rotation of the spine. Hips are set. They aren't moving. We're just rotating the spine. Yeah, good. So another term is called circumduction. And that is a big circle with a pinpoint at your shoulder. So the pinpoint is the shoulder. Make a great big circle, either forward or backwards. And that's circumduction of the shoulder. I wanted to distinguish here when we talk about lateral flexion. Lateral flexion, so flexion that's happening in the lateral plane, is normally to do with our neck. Bring your ear towards your shoulder. You are laterally flexing your neck. Laterally flexing, bringing the right ear to the right shoulder, laterally flexing the neck. But typically we see flexion and extension of the neck as flexion and extension. Flexion and extension. But sometimes we get asked a question about lateral flexion, and that's this movement. We see again elevation and depression, elevating of the scap, depressing of the mandible. And then supination and pronation. Supination, so we usually hear this supine and prone when we're talking about a position of the client on the table, right? So when someone is in supine position, are they face up or face down? Supine. So supine position. Are they face up or they face down? Because this will inform supination of the forearm. Yes, that's right. Yes, Tanya. Yes, Lana. Yes, Val. Yes, Pumla. Yes, Maria. Yes. So supine position is face up, like you're holding a bowl of soup in each hand, right? And so supination of the forearm is movement. Soup, please. Soup, please. Supination. Pronation is as if you're turning prone, as if you're telling your client, go ahead and turn prone. We would say go face down, but supination of the forearm, you could hold a cup of soup. The movement that brings you to holding a cup of soup. Prone. Some people like to say opening and closing the doorknob. That's what the example is here. So if you're opening the door, yes, supination. A couple other movements of the body, and that is inversion and eversion of the foot. So inversion, go ahead and turn your feet in turn the soles of your feet towards each other. That is inversion of the feet. The soles don't have to be touching each other. You can invert one foot. An eversion is a lifting of the pinky toe. So in everting the feet, lifting of the pinky toe. Here in this example, we see an example of plantar flexion and dorsiflexion. So you see stepping on the gas, plantar flexion. Now in ballet, it's point and flex, right? So you're not going to see point and flex on the MBLEx. Probably not. Very highly unlikely. You will see plantar flexion and dorsiflexion. So that dorsal fin, activating that dorsal side, flexing the dorsal. So dorsiflexion and plantar flexion. Last few movements, protraction of the jaw, retraction of the jaw. Go ahead and protract, retract, and then mandible deviation. And then there's some opposition. Flex, extend, oppose, or opposition. Bigger picture, good. Dorsiflexion of the ankle, good. Plantar flexion, so pushing down on the gas, pulling up off of the gas, or up off of the brake. Inversion and eversion of the foot. And we do flex and extend our toes. Ooh, so many movements, right? Okay, this is of the spine. We moved into a new region of the body. We're in the spine and the thorax. So the thorax is just this thoracic cavity. So spine and thorax. So flexion of the spine is like a sit-up. Extension of the spine. So if you were on a big old ball, I'm actually sitting on a big old ball, right? So big old ball and you're on your belly. Extend your spine. That's spine extension. And we talked about rotation of the spine. And we can have lateral flexion of the spine. If you're sitting, go ahead and sit on your sit bones. Keep your hips, put your hands like right on your hips. And just laterally flex your spine. Don't let your hips come up. Laterally flex your spine. Good. Moving up the spine into the cervical region, flexion and extension, rotation of the cervical spine, and then lateral flexion. All right. Woo. A lot of movements here. Okay, since we're here, right here at the thorax, I wanted to mention that the ribs move. The ribs elevate and expand when we inhale, and the ribs, they contract, they collapse, they depress, they go back down. So there's depression and collapse of the rib cage upon exhalation. So try it. Inhale and feel your ribs. They go out and up. Exhale. They go down and get smaller. So expansion, elevation when we breathe in, and they collapse and go down, depress, squish together when we exhale. And do you remember what muscles move the rib cage? They're the muscles located in between the ribs. Do you remember what the muscles in between the ribs are called? All right, we got a couple answers. Yay! Maria got to the answer. Here's a close-up picture. So elbow, so this is the elbow and the forearm. And you'll see this is a flexion of the elbow. So just a traditional dumbbell weight. So imagine you had a dumbbell in your hand. Bringing that dumbbell closer to the shoulder is flexion at the elbow. Bringing that dumbbell away from the shoulder, considered extension of the elbow. At the elbow. Flexion of the shoulder is different. Flexion of the shoulder is done in the frontal plane. Flexion of the shoulder. Remember, extension of the shoulder. You're reaching behind to get that baton. So you're now an Olympic athlete. You're jogging along, waiting for your teammate to hand you that baton. In that baton, that position of your arm is an extension of the shoulder. So flexion of the elbow, extension of the elbow. All right, good. And we've talked about supination and pronation already. At the radiocarpal joint, so right here at the wrist, flexion of the wrist, extension of the wrist, flexion of the wrist, extension. And then we can do a little abduction and adduction, but that little wave thing, you got to be careful because remember you're in anatomical position. So stick your arm out, thumbs up, and then bring your pinky closer to the body. That's adduction, right? You're adding to the midline of the body. Abduction would be thumb away. You probably will not see that question, but good to know you can abduct and adduct at the wrist. Most likely you'll see that abduction question as it pertains to hips and legs. So adduction at the hip and abduction at the hip. Ooh, okay, home stretch here. So we've talked about elevation and depression of the shoulder blades, elevation and depression of the mandible, protraction, retraction, lateral deviation. But really what this slide is about is the pelvis, because it is important to understand what is an anterior tilt and what is a posterior tilt. So an anterior tilt to the pelvis. So we have this anatomical structure here called the pelvis, the ilium. And in front of it here, ASIS, the anterior superior iliac spine. And the anterior tilt is the one that you're probably most familiar with. It actually makes the tailbone stick out. So take a look at this picture. Anterior tilt to the pelvis, right? We've got a Kardashian here, we've got Queen Bee. But look at this little image beside it. We're talking about the pelvic basin. So if we just thought of the pelvis as a big old bowl, the bowl would be tipped to the anterior. So an anterior tilt, we're going to take that bowl and tilt it anterior, tilt it to the front. By comparison to posterior tilt, and that tucks the tailbone under. And you'll see here the ASIS, actually see how it is here and it comes down? Here it goes up, kind of, even though it's a posterior tilt, it goes up. But that tailbone tucks under, and so that whole pelvic basin changes. Take a look at this one. Called the grandpa pants, right? Got grandpa pants. All right, so again, if that posterior tilt to the pelvis, if we're thinking of the pelvis like a bowl, and we have a posterior tilt, that's going to tuck the tailbone under, that whole pelvic basin is going to tilt back to the posterior. Okay, making sense? Good. And then we do have also sometimes, I'll call it a lateral tilt. If one side is higher than the other, that can actually cause a problem. Typically, that's related to this muscle. If we have this going on, a lateral tilt, and typically it's this juicy muscle, which is awesome to work in a massage, by the way. Do you recognize it? It's the last rib. It's not the psoas, by the way. This is on the last rib. The psoas actually comes through here and attaches down here at the lesser trochanter. This is a back muscle, attaches to the pelvis. Any guesses? All right, I'll go ahead and show you. Oh, somebody put a guess in. Yes, Kiara got it. Boom, shakalaka. Oh, so did Val. Very nice. Yes, the QL or the quadratus lumborum. So it attaches through it surrounds the lumbar muscles, but it's not a quad muscle. See how it has that? It's just called QL or quadratus lumborum. It's not part of the quadricep group. There you go. All right. But any imbalances here can show up as a tilt in the pelvis. Let's move along to the femur. It's a nice long bone of the lower leg, or of the leg, I should say. And we've talked a little bit about movement of that femur. So when we talk about movement of the hip joint, we're talking about movement right here at that ball and socket, that acetabulum, and movement of the femur. That's specifically what we're talking about. So take a look. Flexion, just like we did with our shoulder. Extension, just like we did with our shoulder. So flexion at the hip joint, see that little red dot indicates the joint. In moving forward in front of you, extension moving behind you. Abduction of the hip away from the midline of the body, adduction towards the midline of the body. And then if you see medial rotation of the hip, they're still talking about the femur. If they say medial rotation of the hip, they're talking about the femur, and they're just talking about your knee turning in. So that whole structure, that whole femur medially rotates. And then it can laterally rotate as well. Okay, last section. Take a breath, take a little stretch. All right. We're going to cover just a few systems of the body so that you're anatomically familiar just with what they do and what they are. So this is the skeletal system. There's 206 bones in the body. And there are about 54 in the hand and 52 in the feet. You don't have to know all those little bones, but just to know there's 206 in the body, and the skeletal system is our skeleton. We've got an axial skeleton, which is the cranium and spine. That's the axial, just like the axle of your car is like what holds everything together. Cranium with the spine. And then we've got an appendicular skeleton as well. And that is everything that's not the spine. So the shoulder girdle, the pelvis, all the upper and lower limbs, those are all part of the appendicular skeleton. So in the axial skeleton, the spine, it does include the rib cage and the skull. So this light gray is the axial, the kind of brownish red is the appendicular. That's all I'm going to say about the skeletal system. All right, the muscular system. There are 3 types of muscles: skeletal, cardiac, and smooth. And the muscular system are all of the muscles in our body. So cardiac and smooth muscles are involuntary. So do you have to think about your heart beating? Nope. You can think and breathe and slow down your heartbeat, but the actual heartbeat itself is involuntary. So both cardiac and smooth muscles are involuntary. Smooth muscles are found like in the bowels, the large intestines. They contribute to digestion, to peristalsis, the movement, the contraction of digestion. Yeah, and we spend a lot of time talking about the muscular system as massage therapists. Skeletal muscles are voluntary and they help with movement. They help move us through the world. Good to remember that muscles, when they are attached to bones, are attached by tendons.
Let's say blackberries.
So tendons attach muscles to bones, whereas ligaments attach bones to bones. Moving away from the muscular system, just a very brief overview of these. We're just going to do a few. Then we're going to move into dissecting questions. So the next system of the body is the cardiovascular system. That has to do with our heart, our arteries, our veins, all that superhighway that is through our cardiovascular system. Good. And so here you see the red, this red superhighway. And typically when we see the red, it's the arteries. So the arteries are bringing blood out to the body. In that blood is oxygen and nutrients that feeds our body. So red oxygenated blood, red blood full of nutrients, full of good stuff that our body needs. So our arteries transport that oxygenated blood out to the body. So 2 main types of cells make up blood, red blood cells and white blood cells, but you also want to remember that the blue system here represents the veins, and the veins are what brings the oxygen depleted blood back towards the heart. So sometimes we hear the term, oh, they were so cold they turned blue, or maybe you get blue lips or blue. It's deoxygenated. Blue blood is deoxygenated, oxygen depleted. So that blood has gone out into the body. It's fed the area of the body it needed to feed with oxygen and nutrients. And then while it was there, that oxygen cleaned up some waste. It cleaned up some waste material, got rid of all the oxygen, and is heading back to the heart or back to a different organ to deposit that waste. So red blood, red usually represents the arteries. Blue blood usually represents the veins. Okay. Next, the nervous system. So our nervous system basically has 2 parts, the central nervous system and the peripheral nervous system. So the central nervous system is the brain and the spinal cord. And then the peripheral nervous system is everything that tracks out from there. You'll see here the central nervous system, the CNS, brain, all the different parts of the brain, the spinal cord, and then the peripheral nervous system, thousands of miles of nerves in our body. And the lymphatic system. So What is the lymphatic system? So what it is, it's a network of different organs. And we have lymph ducts and lymph nodes and lymph vessels that actually contribute to our body's immunity. So the lymphatic system helps our body's immunity. I'm deciding on whether to tell you what all the parts of the lymph system is. So you've got the spleen, you've got the heart, you got your lymph nodes, right, in the armpits, throat, the groin area. But just know that the purpose of the lymphatic system is to help our body fight pathogens, fight anything that has gotten into our system that is going to be an infection, bacterial, those types of things. I think that's the last picture I have of. Yep, I do. All right. So if you need to know more about that lymph system, look it up. But there are 7 other systems, and I thought we'd be kind of close to the edge of our time. So we're just going to mention that we reviewed the skeletal, muscular, cardiovascular, nervous, and lymphatic system, a system of lymph. And there's 7 other systems that you'll need to know their anatomical structure and their function, and that's the digestive system, the respiratory system, the integumentary system, also our skin. We have reproductive system that's different for males and females. And then some people call it the urinary system or the excretory system. And so that's the process of eliminating waste. But those are our systems of the body. So welcome back. Welcome to your foundational learning of these systems of the body, these movements of the body, and how to describe it. You ready to dissect some questions? Let's go dissect some questions here. The gorilla is clapping. Clapping gorilla. Great work. Good job. All right, we've got 5 questions, which should take us about 5 more minutes. Ready? When the arm bends at the elbow, what is that movement called? Flexion, extension, adduction, abduction. When the arm bends at the elbow, what is that movement called? I see some answers coming in. So let's use our test-taking strategies and let's eliminate one wrong answer. I'm going to go ahead and eliminate letter D because it's flexion and extension. We're not talking about abduction. So of the 3 remaining answers, which is the best answer? I want to give a shout out to Maria, to Kiara, to Lana, to Pumla, Marina, Val. Yes, 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 yes. Here you go. It is correct. Letter A, when the arm bends at the elbow, that is called flexion. Good job. Blank of the hip moves away from the midline of the body. The blank of the hip moves away from the midline of the body. Adduction, abduction, flexion, or extension. All right, so away from the midline of the body, we're in that lateral plane. So blank, we're looking for a movement here. Blank of the hip. We got some answers coming in. We're going to eliminate one wrong answer. So very good, very good. Let's eliminate one wrong answer. It is not extension of the hip because we now know extension is kind of bringing that leg behind us, and we're talking about the hip. Well, we know that extension is the movement where the leg moves behind us. The femur moves behind us. And we've been asked a question about the femur moving away from the midline of the body. All right. So it's not extension. All right. I see more answers. Excellent. You guys are on point here with your movement. Yes, Maria, Lana, Val, Marina, Marna. You have to tell me how to say your name, honey. Marina. Tanya, yes. Pumla, yes. Kiara, yes. Boom. Abduction. Yes. So this is that hip. So here's the hip, right? But that hip moves the femur away from the midline of the body, and that is called abduction. Good job. Pressing the gas pedal moved the blank into blank. Pressing the gas pedal moved the blank into blank. It moved the hand and wrist into flexion. It moved the foot and ankle into dorsiflexion. It moved the foot and ankle into a point. And moved the foot and ankle into plantar flexion. Ooh, we see some answers. All right, so let's get rid of one wrong answer. We know this does not have to do, the hand and the wrist don't have to do with pressing on the gas pedal, right? So that's not that. All right, I see lots of accurate answers. The answer is the foot and ankle into plantar flexion. Yes, so pressing down on that gas pedal, move the foot and the ankle into plantar flexion. Technically, it's plantar flexion at the ankle. Which of these are not systems of the body? Which of these, so this is, again, take a look here, which are not systems of the body? A, lymphedema, B, integumentary, C, digestive, or D, respiratory? Which of these answers are not systems of the body? Oh, you were not fooled. All right, you ready? Well, we know the digestive is a system of the body, but the correct answer is A, lymphedema. Even though it has lymph in the name, lymphedema is not the name of the system. Lymphedema is a pathology of the lymph system. It's a dysfunction, it's a disease of the lymph system. So good catch, you weren't tricked. I was trying to make that tricky. So good job, Lana, Tanya, Marna, Marina, Val, Maria. Yes, good job. All right, I believe that was the last question. Oh, we have one more. All right, the CNS and PNS are part of what system in the body? The CNS and PNS are part of what system in the body? Skeletal, integumentary, nervous, or circulatory? Let's get rid of one. Wrong answer. We know it's not the skeletal system because those are the bones, right? What is the CNS and the PNS? Do you remember? When you remember, you'll remember what part of the body it's a part of. Oh, I see lots of answers. Very good. Kiara, Maria, Val, Pumla, Tanya, Marina, Marina. Yes, yes, yes. The correct answer, the CNS and the PNS, are part of what system in the body? That is the nervous system, letter C. So the CNS, the central nervous system, the PNS, the peripheral nervous system. They are part of the nervous system. Yes, the N means nervous. That's right. All right. Yay. Great work today. Very, very good. Boy, what a review, huh? I know this is navigating the body. And this is this is navigating the body. So yeah, it's a lot. But this is the foundation. This is the foundation for all of those other anatomical questions. Once you understand these questions, then you understand, then you can dissect the question more fully, truly understanding what the question is asking. And so often, you guys, once you understand, I've seen people score terribly on the practice exams, right? In the 50s, in the 30s. And you know what? They actually knew the answers. Yeah, they just didn't understand the question. Once you understand the question, you actually know the answer. I'm telling you. So take your time on those practice exams. Take your time understanding what the question is asking. So I will sign off for today. My name is Jody Scholes. I am your instructor for the MBLEx review course. I'm going to stay on here in class for another few minutes after we end the recording, in case you guys have any particular questions on the stuff we've covered, or just on the Patreon community, how to use the practice exams, how to access the classes, the longer classes. So I'll stay on to answer a few of those questions. But for now, signing off, reminding you that this journey is perfect. It may be taking longer than you thought it was going to take, but that's okay. It really is okay. The journey is perfect. So see you again real soon.